Emergency services.
My daughter's, she's suffering pretty bad from asthma panic attack and, she's gone worse.
It's a busy night at the Emergency Communications Centre as dispatchers receive a desperate appeal for help from Melbourne's outer east.
Okay, is she breathing?
Yes.
Is she still awake then?
She's limp, she's collapsing.
The caller's daughter is having an asthma attack so severe, she urgently needs help from a mobile intensive care ambulance.
Thanks, Micah 30, backing RC 732,
Micah Paramedics, Mark and Karina, have specialist training and attend the most life-threatening situations.
She's gone brutal. I'm going to lose her.
Listen, cancer, okay? I'm going to tell you how to give mouth to mouth. 2 breaths and 30 pumps. I'm right here with you. Don't give up. This will keep it going until the paramedics arrive.
Another crew has already arrived on the scene and radios through with news.
Patient's pre-arrest, currently respiratory asthmatic arrest.
Give it adrenaline, kids. Give it adrenaline.
During pre-arrest, a patient's heart can stop beating at any time.
Clear left.
Asthma is such an incredibly dynamic disease. Literally minutes can make the difference between life and death.
Yep, go for it.
So on the way to the job, you start to formulate a plan about the things that we're going to do, the medications that we're going to use, right down to how we're going to get this patient out of the house. Because if we don't get there and intervene very shortly, then she's going to die.
Hey guys, how are you? Mark and Karina?
The situation at the scene is critical. Distraught mum Anna has been watching on as paramedics William and Caitlin battle to keep her daughter breathing.
What's her name?
Kelly.
Kelly, open your eyes for me, darling. Open your eyes for me. I see that she's unconscious, she's sweaty and she's blue and she's not moving much here at all, and I know that she's knocking on death's door. All right, adrenaline 1,000, 500 mics.
The Micah crew have administered 4 adrenaline injections in a desperate attempt to kickstart Kelly's breathing. But there's been precious little response.
Kelly, open your eyes for me, darling. Open your eyes for me.
We need to step it up. I need to give her an infusion via a drip in the hope that we can open up her airways and help her to breathe.
So 100 mics per mil.
100 mics, I'll give it.
Do you want to? Okay. Sharps out, guys. Really, I mean, unless the adrenaline turns her around profoundly, she's going to need intubation. I'm acutely aware of what's at stake. Kelly's dying of asthma right in front of us, and I know that unless we do our job effectively and that the next few steps work well for us, it's about as serious as it gets.
Mum Anna knows the situation is dire.
I was saying my prayers, don't take her away from me. This cannot happen. This cannot happen.
In a desperate attempt to open her airways, paramedics Karina and Mark are now pumping adrenaline directly into her veins.
Kelly, can you hear me? We're just helping you breathing, okay?
In my experience, most asthmatics respond to adrenaline. We'd expect to see some improvement in their breathing or in their conscious state, but Kelly just isn't responding at all, and it's really concerning.
Just a few hours ago, Anna was enjoying lunch with her daughter.
Kelly, I'm here with you, darling. You can do it, darling.
Now, she's struggling to understand what went wrong.
Come on, darling. We can do this. Come on. Okay, Kelly, I'm just going to suction a little bit, okay, darling?
Her breathing started to go a bit funny, like shortness of breath, and then it got into deeper and deeper. In that moment, I was losing my daughter because after seeing her like gasping for air and turning blue and just looking at me in the eyes, and I was looking at her straight in the eyes as if she'd say, "Help me, Mum," but the words will not come out.
A swab and a 20, please. As a parent myself, I just can't imagine what Kelly's mum, Anna, is going through in this moment. She's never seen her daughter so sick with asthma. It's all so foreign to her, and this is her absolute love and joy dying in front of her on the living room floor. Her conscious state's still profoundly compromised.
Yeah. Kelly, squeeze my fingers. Squeeze my fingers.
The adrenaline infusion isn't working and time is running out.
Kelly, open your eyes, darling. Kelly, open your eyes for me.
There's no doubt Kelly is one of the sickest asthma patients I've seen in my career. And right now, she's fighting for her life. At this point, I know that we're going to have to intervene. We're going to have to intubate her. We're going to have to put a tube down into her lungs and breathe for her.
Intubation is a risky procedure. Kelly will be placed in a coma so oxygen can be pumped directly into her lungs.
Atropine, 600 mics. And adrenaline, 100 mics a mil. If her heart rate drops below 60 at any point, she becomes bradycardic. I'll ask you to push the atropine. Okay? The entire dose. If we have any problems with blood pressure, etc., I'll ask you to push 100 mics. So 1 mil. I'll explain it to you again when we do it.
So we've been forced to make the decision to take over Kelly's breathing. And when we do this, when you put a tube in somebody's airways, there's always the massive potential for complications.
We're just going to give you some drugs, sweetheart, some medication to make you sleepy, all right?
This is a really critical moment. Once we give those medications, we've only got a couple of minutes within which to successfully perform the procedure. And if we can't do that in those couple of minutes, then her oxygen levels will fall even further, and that's of dire consequence to her condition.
Just want to open the mouth for me?
To make way for the breathing tube, an instrument known as a bougie is used.
Oh, hang on. Bougie?
Bougie. Can I have the atropine in, please?
All right. So the bougie is in the trachea. It's a grade 1 view intubation. That's what we want to see, guys. A respiratory waveform.
The intubation has worked, but Kelly is still in grave danger.
Now that we've successfully intubated Kelly, she needs to be in hospital as soon as possible. And that's the next step in her care. But to get her out and to get anyone in her position out of a house is actually more complex than it seems.
Just so everyone is aware, she's now long-term paralysed with pancuronium, all right? So maintenance of this tube is critical. So if there's a risk, I'll just yell out straight away and we all stop immediately, all right?
So stop at any point, we stop.
Just say stop. Yeah.
Moving Kelly is a massive responsibility. She's sedated, she's paralysed, she's unable to breathe for herself. If we dislodge that tube at any point in this move, she's in massive trouble, and so are we.
All right, are we all okay? Yep. Okay, ready, set, go.
The team must now work seamlessly to lift Kelly to a waiting stretcher.
Pivot, I think, from Karina. You'll be going that way. And you're walking.
So we're going to go out feet first.
You're going to go... All right, one more towards the centre of the room.
Okay, this one, I want half that movement, all right? Ready, set, go. Stop. Yep. Okay, is this the last movement, guys?
Last one.
Terrific.
30 centimetres.
Everyone okay? Yep. Ready, set, go. Okay.
Blanket's at the foot end. You can pull the blanket up.
Kelly has now been fighting for life for nearly 2 hours.
Kelly's body's just exhausted. We're doing everything we can to save her.
Kelly will now be rushed to hospital, where life support systems can continue breathing for her.
To be looking after Kelly as a 25-year-old female in the prime of her life is an enormous responsibility. Kelly's situation is grave. I'm really not sure how things are going to end.
Very sweet. Anna, we'll take good care of her, okay? I promise you.
After seeing all the paramedics, I think then I went into my own shock because seeing Kelly like that, it is a mother's worst nightmare. I thought, my God, what am I going to do? I've lost my little friend. I've lost her.
Miranda, this is Micah 30. We are on our way to you with an ETA of 20 minutes.
Mark and Karina are rushing 25-year-old Kelly to hospital. Since suffering a life-threatening asthma attack, she hasn't been able to breathe on her own. Now, only a tube to her lungs is keeping her alive.
It's our job to continue to breathe for Kelly and to keep her stable. This actually gives her the first opportunity to start to rest and recover.
Okay, we're settled for the time being and treading water nicely.
Kelly's mum, Anna, has been at her daughter's side throughout the ordeal.
I can't even begin to imagine what's going through Anna's head at this point. Every inch of her just wants to be touching Kelly, helping, and yet she sat there so amazingly controlled and supportive of her daughter in this hour of need.
Just swap fingers.
The bond between Kelly and me, she's just amazing to me. I've always said to her, I'll always be there, I'll always hold you, I'll be right next to you.
As a paramedic, you're always doing your best to try and save someone's life. But unfortunately, we know through our career that that's not how things always end up. Sometimes, no matter how hard you try, and with the best intentions, you can't always save someone's life.
Just a couple little bumps coming into the hospital.
The next 24 hours will be critical for Kelly's survival.
I know that Karina and I have done absolutely everything we can to give Kelly the best chance of surviving. And I'm really hopeful that that's the way things are going to end up, but I'm really not sure.
It's been 2 weeks since paramedics Karina and Mark were called to 25-year-old Kelly's life-threatening asthma attack.
Last time I saw Kelly, she was gravely unwell, and since then, not a day has gone past that I haven't wondered about how she's going, and I've just been really hoping that she's pulled through this.
After 3 days in a coma, and against all odds, Kelly has made a complete recovery. Now, together with mum Anna and fiancé Maya, she's paying the crew a visit to say thank you.
Hey, how you going? Hi, Anna. How you going?
It's so nice to see you well.
Hi, Kelly. How you going?
You look so much better today. That's fabulous.
Yeah,
Thank you so much. When I see Kelly, I'm actually quite surprised by how emotional I am about it. It's incredibly rewarding and I actually get a bit teary.
You know, it was touch and go there, there's no doubt about it. And so, Karina and I have been extremely excited about meeting you again. Yeah.
So am I, actually. I'm just very excited as well. So I stayed in ICU for 3 days. On the third day, I woke up and they took the tube out of my throat and I was able to breathe on my own. Doctors diagnosed me with pneumonia on my left lung, which caused me to have a chest infection, which caused me to have a severe asthma attack.
So obviously you've been an asthmatic since you were a little kid, is that right?
Since I was little.
Yeah, okay.
And I've just had no real good management over it.
Yep.
Mark and Karina have done so much. You know, they've saved my life. They, you know, brought me back to my family. If it wasn't for them, I wouldn't be here today.
Appreciate it so very much.
No, you're welcome.
You're more than welcome.
Yeah.
You're more than welcome.
I just want to thank you all as well, because now I get to marry my beautiful girl. Thank you very much.
Great, mate. Fantastic. Congratulations. Yeah, absolutely. It's a very, very emotional experience to be involved in giving someone like Kelly a second chance at life. The fact that she's pulled through and she's made a full recovery is incredible. These sorts of outcomes, you know, in patients that are critically unwell and so young with their whole life ahead of them, it's an incredible experience to be a part of and absolutely why I joined the job.
Thank you so much.
Yeah,
Thank you.
Thanks.